Alberta healthcare has never been this bad. That's directly from a physician with 25 years caring for Albertans, and he says many of his colleagues concur.
We are currently in a state of crisis, disaster, emergency, whatever you want to declare it. The demand is definitely overwhelming our ability to provide safe and timely care, and we need help.
The call coming as officials investigate the death of a 44-year-old father who died in an Edmonton emergency room while waiting almost 8 hours for care. Dr. Paul Parks believes several things could be done to help the system right now. Many involve shuffling patients around.
Load leveling, repatriation of patients that are not ready for discharge from hospital but could go to another hospital. There's mandatory, placing patients in long-term care and nursing homes across the province on a first-come basis. There's, coordinated postponement of scheduled surgeries.
The ER wait time here at the University of Alberta Hospital is about 5 hours Monday afternoon. According to stats shared by doctors, it's one of 9 Alberta hospitals that are currently at 100% or more capacity.
On Tuesday when we were here, we waited about 5 hours. So yeah, it's a bit rough.
Elena Gunderson recently brought her 10-month-old son to the Stollery Children's Hospital. She agrees wait times are out of control. Would you be willing to pay a little bit more for better
100%, yeah. I mean, I don't want us to turn into the States where we have to pay out of pocket to get like top-level care, but something needs to improve for sure.
But others believe the waits are not a big deal.
I've been stuck at university here for 6, 8, 10 hours. Get a coffee, take a pill, relax.
Dr. Parks alleges the government is missing in action during this crisis. Health officials and ministers last provided a press conference on the matter more than 3 weeks ago. The Premier is on vacation and out of the country until next week.
There is a lot of confusion right now, and I will say that's by design. Danielle Smith has been really intentional in causing chaos in the healthcare system and trying to find new people to blame for the problems, but the Premier is who's responsible for public healthcare.
The NDP alleges the government has wasted tax dollars on things like trying to privatize lab services instead of making smart investments. The Auditor General recently pegged that loss at about $125 million.
They've also wasted hundreds of millions, if not more, on the corrupt care scandal with private surgical centers offering sweetheart deals in certain places. And none of those deals were better value for buck than the public healthcare system.
Nobody from the government was made available for an interview Monday, but UCP officials say all resources are being used to help treat a rush of flu patients, and more than 300 surge beds have been added. A press conference on healthcare is being planned for later in the week. From Edmonton, Sean Amato, City News.